Lately, my job as a dentist has taken me on an emotional roller coaster. Recently, I've been sharing with you my lifestyle and what I do on a day-to-day basis as a dentist, the good and actually some of the bad. And today I want to express why being a dentist is an extremely depressing career and why it makes me sad internally. All right, first and foremost, I've been an absolute punching bag for my patients lately. Sometimes you can sense what patients will be more frustrated than others, and they may not necessarily be mad at you, but they're very mad at the situation. And you're the doctor that day, so they take their anger out on you. And the sad thing is, it may not be the doctor's fault if things go wrong. There are times where I'll take on a case that another doctor has started. A crown from the lab comes back and it's not fitting properly. And the patient is absolutely furious. The whole office hears about it. You hear, how could you do this to me? I took off of work. I can't believe this office is doing this kind of work. This is unacceptable. Last month, I had a patient literally tell me it was my fault with the preparation design. They were like, yeah, you could have made it a little more bulbous on the tongue side. The thing about dentistry is that you can't control all the factors all the time. Dentistry is not an exact science. Like, you can do everything by the book, you can follow all the technique principles, but you realize that we're working with human biology. And there are so many variables that are out of our control, right? Just think about it. Every patient's anatomy is different, their biology is different. Where their bite is often different and not exactly the same as everybody else's. So when the patient goes home with your prosthetics and they just start abusing it by biting into really hard foods, never really cleaning it with brushing and flossing techniques, now your work is subjected to high levels of stress. So when a patient comes back with a crown that popped off, you have to understand that, yes, you can try your best, but at times you can't control everything in this profession. And that's a really hard pill to swallow. If you did the work, that failure is inevitably yours. You can place an implant, but if the patient is smoking every single day afterwards, and you have to take that on the chin when the patient comes back with a failed implant. So lately this has been happening to me. Crowns have been popping off. I had a few implant failures recently. This is the case of the matter because we're not working in a sterile lab environment. This is dentistry in the real world setting. And everything is extremely unpredictable. Which brings me to my next point of always being able to be on time. A lot of our patients don't realize how unpredictable dentistry is. One procedure might go really smoothly, and then all of a sudden, you're on a different tooth working, something goes wrong, and now it's an hour delay, and now you're left to fix this. And the next patient now is extremely upset because now their appointment is delayed. We've all been there, right? The patient walks in the door, you know that they're upset already because their appointment's a little bit late, 10 minutes, 15 minutes late. It does matter. I'm not here to say it doesn't matter to patients. We should always be respectful of their time, but that appointment is just a little quieter and it just never really goes as well as we'd like it to. And then they ask you, hey, how long is this gonna take? It depends. It depends is the best answer because you don't know. You can take all the x-rays you need, do a CBCT, you can tell how many canals it has when you're doing a root canal. It only just takes one tooth to throw off your whole schedule for the day. And now you're scrambling, the staff is upset and getting overworked, people are working through lunch, and all that stress just comes down on me as the dentist practicing. It makes me really sad because we try to do the best work we can, we try to be as fast as possible, but doing clinically quality work, patients don't really realize the extent of the difficulty it takes to work on a 10mm object through telescopes with water and a mirror upside down vision with a tongue in the way. It's a really complicated job and we don't get the credit we deserve at times. As this starts to happen often, it begins to wear on you and it starts to make you question, are you a good dentist? Am I doing the right things? And lately my experiences with patients have gotten me quite sad because these interactions stay with you as you leave the office. It just starts to destroy you little by little over time. It's like you're trying your best to help people. Every once in a while we get one of those days where it seems like the entire office is on fire and all these little mistakes start to add up and nothing is going right in your favor. Which brings me to my next point, which is working as a new dentist clinically is extremely overwhelming. I can comfortably say that I've done over 500 implants in the last 7 months, which is like oral surgeon numbers. And it's no small feat for anybody to do. If you check my Instagram, I'm posting cases about implants all the time. But inevitably, with this kind of workload, you will start to see failures. This is biology and this is dentistry. And especially when you're learning as a new grad dentist, failures can scare you away from ever trying the procedure again. Like, come on, we've all been there. You're doing an extraction, root tip breaks in the bone, you get a little nervous, patient's wondering why it's taking so long, you decide to refer out. And then the next time you see an extraction like that on the x-ray, your heart skips another beat, you worry if you should do it. Then there's a little bit of uneasiness. Maybe I shouldn't try this again. Maybe I just refer out. But if you think like that, you'll never grow as a doctor. And it's a really hard pill to swallow that you have to learn from that experience and try to be better next time. And referring out anything slightly complicated means that you'll be losing out on millions of dollars over the next 25 years of your career. And something I'm currently going through now is, so patient management is brutal. Be aware of these things. And on the topic of doing high-level work like implant surgeries and full arch crown and bridge work, you start to critique your work because you know what's ideal, what will work, and what won't work. You can't create a perfect margin on every single tooth for the next 20 years. There's always circumstances whether the tongue is too big or there's limited opening. There are a ton of reasons why you may not be able to do ideal dentistry. And when I see imperfections in my work, it eats me alive and just makes me sad because it creates a sense of inadequacy. And with the implant cases, I don't do every case guided. Now, I think there's a time and place to do guided surgery, but I also think it's very important that you learn to do implant dentistry freehand, no guide. I think the biggest mistake that most dentists start doing is that they start guided and they never really learn the freehand way, to the point where you're doing bigger cases and then the guide doesn't fit and the guide doesn't work anymore. I've seen disasters where docs don't know how to do freehand implant dentistry and the guide is completely misplaced. Or somebody making like $12 an hour working for these big implant companies. Maybe you do your first 10 or 20 implants guided, and then you hop off the guide and start really learning how to flap, how to remove bone, how to get the proper angulations, and you get a real nice feel for the implant motor going in, even using a hand wrench as opposed to the motor, because you get a more tactile sensation on what's going on. All of these things have a very big effect on your overall surgery prognosis going forward. And as you start to pay more attention to your work, you start to realize how it can be better every single case. And that's the beauty of dentistry, is that you begin to train your eye to understand where things belong in the mouth. With the implants, over time, you start to learn the prosthetic placement, prosthetically driven implant surgery. And since dentistry is an imperfect science, those little mistakes eat away at you every single time. And I go home thinking about these things. I got 50 newtons of torque on that implant. I wish I could have gotten it a little closer so I can get a better prosthetic outcome. Or the angulation of that implant is slightly off. Yes, these problems get solved with guides for the most part, but I still believe in using freehand implant dentistry to make sure I have the skill set to do both when I need to. And I am incorporating more guides going forward. And when complications arise, or I just want to run a case by somebody, I don't always have somebody readily available to talk to, because there's just not many doctors doing high-level surgeries like this. And since there aren't many doing it, it also makes it a very isolating area of discussion when I'm trying to reach out to people and talk to my colleagues. Not many are doing it. So when I go home, I just try to turn my brain off and forget about dentistry for a few hours. But if you're ever going out on the town or listening to somebody or talking to somebody at a bar or a restaurant and you tell them you're a dentist, forget about it. Like, you're entertaining that conversation for like the next 20 minutes. They may run a treatment plan by you, like, oh, my tooth is in pain. You know, actually Invisalign, like how does that work? I'm just like, oh, can you just book an appointment or something? Like, can you Google this stuff? You can Google it, please. I don't want to talk about work right now. Work is very emotionally taxing for me. And at times I don't know how to handle these emotions. And the stress of it all leads to a lot of sadness and depression. But don't get me wrong, there are moments in dentistry that I've experienced that make me excited to wake up and happy to be a dentist and help people. These are the moments that I live for. You know, that smile transformation moment. You hand them the mirror and boom, like, wow. Their whole reality has changed, and those are amazing moments. Or that patient in wisdom tooth pain who's been crying uncontrollably. I see them in the follow-up visit and their spirits have been lifted. These are the moments that make me very happy to be a dentist. But you have to realize that it's sprinkled amongst all of the problems of inadequacy, sadness, and the depression, constantly dealing with people at the lowest of their lives. We're always around anxious people. Seeing a person's eyes during an injection, you feel their pain. This is just the struggles that we must go through as dentists. I say sorry every time I do an injection. I put hella topical benzocaine on there. I dry it up, I make sure. I'll even do mepivacaine sometimes to start before I give the lido or before I give the septo to make it more bearable. But we are inflicting pain on people every single day. It's part of our job, and to be around that frequency of energy is very destructive to my own mental health, and it's the reason I'm making this video. It's because dentistry is a really hard job and it's emotionally draining, but there are fleeting moments of gratitude and happiness and joy that make the entire journey and all the struggles absolutely worth it. You just have to keep reminding yourself that every day, and I'm working on doing that myself. If you're going through a struggle like this, if you're in school or you're a practicing dentist, just know that you're not alone. And I do feel very vulnerable sharing this part of my career with you, but if you are in a down place in your career, hopefully you're able to understand that we're all going through this together, and with time, things will get better. So let me know what you think about this video. Drop a comment down below, like, subscribe, let me know. Dr. Rana, signing off.